Hi everyone, I'm Varda Adenbach, the founder and CEO of Samplfy. As a big fan of technology, I'm fascinated by how it simplifies and automates the way we do things. It's almost magical how it changed the way we communicate, the way we consume music, and the way tedious tasks like washing our clothes or dishes became simple. So it's about time we progress and change the way we take our most basic medical tests. All around the world, this type of containers are used for urine tests. For a test associated with chronic kidney disease, CKD, people are required to collect all their urine over a period of 24 hours into a 2 to 4 liter container. CKD is the leading cause of mortality and morbidity worldwide. A third of US adults are at risk of CKD, while about 90% of them are unaware of it. Monitoring is therefore essential. Now think of older adults, women, and specifically pregnant women who have to take the test. The flaws of the current methods lead to low patient engagement, namely non-compliance, uncompleted and rejected tests, no test, no data, which lead to delayed treatment, suffering, and high burden of direct and indirect costs. Inaccurate test results provide unreliable data that lead to undesired treatments. Manual, error-prone processes of collecting information on urine samples result in incomplete and inaccessible data. I noticed the problem when my niece was struggling to complete her 24-hour urine collection. Thinking that people would take their test if they were simple and static, I started researching the matter and developing Samplfy solution. I teamed with Danny Shachaf, who is a medical device development expert. We are pleased to have Professor Donitsky El-Halel, Head of Nephrology, Hadassah Medical Center, on our advisory board. Samplfy obtains and uses qualitative data from urine tests by a complete solution comprised of 4 parts: samples collection, digital detection of urine information, analysis of this information and automatic updating of the electronic medical records, utilizing of the obtained data for guidance and monitoring. So let's meet Emma. Last time when she took the 24-hour urine collection test, she had to stay at home. Now, with Samplfy Kit, she can continue her regular routine. When needed, she enters a nearby restroom. Emma takes Samplfy Kit out of her bag and unfolds the disposable toilet cover. She easily places it and urinates regularly and fluently. Once done, she obtains a sealed tube with a sample. For the next step, let's refer to the prototype demo. This is the designed cover, and here is the prototype. This is apple juice, in case you wondered. After urinating, the person lifts the test tube and inserts it into the 24-hour container. 24 hours later, the container is filled with all the samples taken over 24 hours. The user takes a picture of the container. Then the user or nurse inserts a regular test tube into the container and obtains the final sample of the collection that is sent to lab. Emma also uses Samplfy Kit for rapid diagnostics without handling urine. Current plastics and manual handled processes are currently used. PESI addresses culture tests but requires urine handling. Healthy.io enables home rapid diagnostics but requires urine handling. Samplfy is adopting the same digital approach and takes it to the next level. Samplfy covers every step of the process for any type of urine test taken at any location. Our solution provides significant simplicity and reliability for the 24-hour collection and culture tests. The global market size is expected to grow due to the growing prevalence of diseases, even of children, the rising of a geriatric population, increasing need in solutions tailored for women, remote monitoring, new usages of urine tests, and government programs to increase awareness to CKD. Doctors in both Israel and US told us that they would have ordered far more 24-hour urine collection tests if there was a solution that their patients would actually use. We plan to enter the market at an affordable cost through a B2B business model offered to healthcare and telehealth providers, nursing and elderly facilities. We ran a primary market research, built a basic prototype, filed for patents, and currently preparing for a trial in Hadassah Medical Center. We wish to collaborate with additional healthcare providers as well as commercial companies. We currently seek funding for the development of our first milestone. We invite you to take part in turning the mandatory urine testing into a pleasant and effective experience. I would like to take this opportunity to thank Hadassah IBM for their efforts and significant help in advancing Samplfy. Thank you so much.